Before we begin today, I want you to pause for just a moment and think about this question. What if some of the medical tests you've always believed were essential after the age of 70 were not only unnecessary, but in certain situations could actually put your health at risk? This idea may sound surprising, even uncomfortable, especially if you've spent years trusting that regular screening is always the safest path forward. But the reality is more nuanced than most people realize, and understanding that nuance could change the way you approach your health for the rest of your life. My name is Dr. Brian Anderson. I am an internal medicine physician and a geriatric specialist, and for more than 20 years I have worked closely with patients in their 70s, 80s, and beyond. Over that time, I've had the privilege of seeing what truly supports healthy aging, not just in theory, but in real lives. I've also seen something else, something that doesn't get talked about nearly enough. I've seen well-intentioned medical decisions lead to complications, stress, and sometimes outcomes that could have been avoided with a more individualized approach. And that's exactly what we're going to explore today. There is a growing conversation within the medical community, one that doesn't always reach the public, about how certain routine tests may be overused in older adults. These are tests that many people are told they should do automatically once they reach a certain age. They're often presented as non-negotiable, as if declining them would be irresponsible. But when you look closely at the evidence, and more importantly, when you consider how the body changes after 70, the picture begins to shift. The balance between benefit and risk is no longer the same as it was at 50 or even 60. At the heart of this issue is a tension that is rarely discussed openly. On one side, there is patient-centered medicine, which focuses on what truly benefits the individual sitting in front of the doctor. On the other side, there are standardized protocols and systemic incentives that sometimes prioritize volume over personalization. The healthcare system, particularly in certain countries, is structured in a way that can encourage more testing, more procedures, and more interventions. These tests generate billions of dollars each year, and while that doesn't mean they are inherently bad, it does mean we need to look at them with a critical and informed perspective. To make this more concrete, let me describe a situation that I see all the time. Imagine a 73-year-old patient walking into a clinic. They feel well. They are active, independent, and managing their daily life without major issues. Perhaps they go for walks, spend time with family, and enjoy a relatively good quality of life. But by the end of a routine appointment, they are handed a list of recommended tests. A colonoscopy, a prostate screening, a cardiac stress test. Suddenly, they leave the office feeling uncertain, even anxious, wondering if something might be wrong that they weren't aware of just an hour earlier. This is where understanding the shift in medical logic becomes so important. Screening tests are designed to detect disease early, often before symptoms appear. In younger populations, this can be incredibly valuable because there is enough time for early detection to meaningfully change outcomes. However, after the age of 70, several key factors come into play. First, many diseases, particularly certain cancers, tend to grow slowly. Second, life expectancy becomes more individualized and variable. And third, the body's ability to tolerate invasive procedures and recover from complications decreases. What this means is that the same test that might offer a clear benefit at age 50 could offer very little benefit and potentially significant risk at age 75. Yet, in many cases, the recommendations have not fully caught up with this reality in everyday practice. Patients are often guided by general guidelines rather than personalized assessments, and that can lead to decisions that don't fully align with their specific situation. Let's take a closer look at one of the most commonly recommended procedures, the colonoscopy. For many years, colonoscopy has been considered a gold standard for detecting colorectal cancer, and in the right context, it absolutely has value. But after the age of 75, the equation begins to change. The preparation for a colonoscopy alone can be physically taxing. It involves significant dehydration, electrolyte shifts, and stress on the body. For an older adult, especially one with underlying health conditions, this can be more than just uncomfortable. It can be risky. Then there is the procedure itself. While generally safe, colonoscopy carries a risk of complications, including bowel perforation and bleeding. These risks are relatively low in younger populations, but increase with age. Additionally, sedation used during the procedure can place strain on the cardiovascular system, which may not tolerate it as well as it once did. When you combine these factors, the overall risk profile becomes more significant. Now, here is where the conversation becomes particularly interesting. A large study published in JAMA Internal Medicine examined the outcomes of routine colonoscopy in older adults. What they found was that for many individuals over 75, these screenings did not significantly reduce mortality rates. In other words, they were not clearly extending lives in a meaningful way. However, they were associated with higher rates of hospitalization due to complications. This creates a situation where the potential harm may outweigh the benefit, especially for those who are otherwise healthy and symptom-free. And yet, despite this evidence, many patients continue to be encouraged to undergo routine colonoscopy simply because it has become part of standard practice. This is not necessarily due to bad intentions. Most physicians genuinely want to do what is best for their patients. But the system they operate within often emphasizes consistency and protocol over individual nuance. As a result, patients may not always receive the full context needed to make an informed decision. This brings us to the second test we need to talk about, and that is prostate cancer screening using the PSA test. On the surface, the PSA test seems simple. It's a blood test that measures a protein associated with prostate activity. Elevated levels can indicate the presence of cancer, but they can also be influenced by many other factors. The challenge with PSA testing in older men is not the test itself, but what often happens next. An elevated PSA level frequently leads to further investigation, including biopsies and imaging. These procedures carry their own risks, particularly in older adults. But perhaps the most important issue is what we might call the hidden truth about prostate cancer in this age group. Studies have shown that a large percentage of men over 70 have some level of prostate cancer cells. However, in many cases, these cancers are slow-growing and would never cause symptoms or impact lifespan. Despite this, once cancer is detected, there is often a strong inclination to treat it. And treatment can involve surgery, radiation, or hormone therapy, all of which can have significant side effects. These include urinary incontinence, erectile dysfunction, and a reduction in overall quality of life. For a condition that may never have caused harm, the treatment itself can become the source of lasting complications. This is where the concept of overtreatment becomes critical. In an effort to be proactive, patients may undergo interventions that ultimately reduce their quality of life without providing a clear survival benefit. It is not that screening is inherently wrong, but rather that its value must be carefully weighed against the individual's age, health status, and personal priorities. Now, as we move forward, the third test we'll examine takes this idea even further. Because in some cases, it's not just about the initial test, it's about what the test sets in motion. And that is something we'll explore in the next section. Let's talk about the third test, and in many ways, this is the one that illustrates the problem most clearly. Because with this test, the issue is not just the test itself, but the chain reaction it often triggers. I'm referring to aggressive cardiac stress testing in older adults who have no symptoms. At first glance, this may sound like a responsible precaution. After all, heart disease is one of the leading causes of death, and identifying problems early seems like a logical step. But the key detail here is this. These tests are often performed on individuals who are not experiencing chest pain, shortness of breath, or any clear signs of cardiac distress. In other words, they are being tested not because something is wrong, but because it has become routine. The problem begins with what we call false positives. A cardiac stress test may suggest an abnormality even when there is no significant underlying disease. And once that happens, the system rarely stops there. Instead, it moves forward. More imaging is ordered. Angiograms are scheduled. And in some cases, patients are told they need stents or even bypass surgery. This is what is known in medicine as the cascade of care, but a more honest term might be the cascade of harm, because each step in this chain carries its own risks. An angiogram is an invasive procedure that involves threading a catheter through the arteries. It can lead to bleeding, infection, or complications in the blood vessels. Stents, while life-saving in certain situations, are not without risk either. They require long-term medication to prevent clotting, and they can create a lifelong dependency on follow-up care. What makes this particularly concerning is that for many asymptomatic older adults, these interventions do not necessarily improve long-term outcomes. In fact, several studies have shown that in stable patients without symptoms, aggressive interventions often do not provide a survival advantage compared to more conservative approaches like lifestyle management and medication. And yet, these procedures remain common. Why? Because once a test suggests something might be wrong, it becomes very difficult, both psychologically and medically, to simply stop and observe. Patients feel compelled to act. Doctors feel compelled to intervene. And the system continues moving forward, even when the original finding may not have required such an aggressive response. To truly understand the impact of this, let me tell you a story. This is a story that reflects not just one patient, but a pattern I've seen repeated many times over the years. Margaret was 74 when she first came to see me. She was active, independent, and had no major health complaints. She enjoyed gardening, walking with her friends, and spending time with her grandchildren. During a routine checkup, her previous physician recommended a series of tests, including the three we've just discussed: a colonoscopy, a cardiac stress test, and additional screenings. Margaret hesitated, not because she didn't trust her doctor, but because she felt something didn't quite add up. She wasn't experiencing symptoms. She wasn't feeling unwell. And she asked a simple question: what happens if I don't do these right now? That question changed everything. Instead of moving forward immediately, we took a step back. We looked at her overall health, her lifestyle, her priorities. We discussed the potential risks and benefits in detail. And together, we made a decision to focus on what would genuinely improve her quality of life. Margaret began walking more consistently, not as a chore, but as a daily ritual she enjoyed. She improved her nutrition, focusing on simple, balanced meals. She stayed socially active, maintaining strong connections with friends and family. And most importantly, she paid attention to how she felt, rather than relying solely on tests to define her health. 5 years later, Margaret was still thriving. She remained active, independent, and mentally sharp. She had avoided the stress and potential complications of unnecessary procedures, and she had invested her energy into habits that truly supported her well-being. Now, contrast this with two of her friends, both around the same age. They followed the standard recommendations without hesitation. One underwent a routine colonoscopy and experienced complications that required hospitalization. The other had a cardiac stress test that led to further procedures, including the placement of a stent, followed by ongoing medication and regular follow-ups. Neither of these outcomes were intended. Both were the result of trying to be proactive, but they illustrate an important point. More intervention does not always mean better health. At this stage, it's important to step back and look at the broader evidence. Because while individual stories are powerful, they must be supported by data. Multiple large-scale analyses, including those published in respected journals like JAMA, have consistently shown that the benefits of certain routine screenings diminish with age, particularly in populations over 70. At the same time, the risks associated with these procedures increase. This creates a tipping point where the balance shifts, and what was once beneficial becomes questionable. In response to this, organizations within the medical community have begun to take action. One of the most notable examples is the Choosing Wisely campaign. This initiative encourages both physicians and patients to question unnecessary tests and procedures. It promotes conversations about whether a test is truly needed, what the potential outcomes are, and whether there are safer alternatives. Interestingly, when we look at healthcare systems in other countries, we see a different approach. In places like the United Kingdom, screening practices for older adults tend to be more selective. The focus is often on individualized assessment rather than routine application. And despite fewer interventions, overall health outcomes in older populations are comparable in many cases. This suggests that more testing does not automatically translate into better results. In fact, it may simply increase the likelihood of complications without providing additional benefit. So where does this leave you? The goal here is not to reject medical care. It's not to avoid doctors or ignore symptoms. It's to approach your health with a deeper level of awareness and understanding. It's about recognizing that after a certain age, the most important question is not, what test should I do next, but rather, what will genuinely improve my quality of life? And this brings us to one of the most practical and empowering parts of today's discussion. Because the most important tool you have is not a test. It's your ability to ask the right questions. At this point, you might be wondering, if some of these tests are not always necessary, how do you actually make the right decision for yourself or for someone you care about? Because let's be honest, sitting in a doctor's office can feel overwhelming. You're presented with recommendations, often in a short amount of time, and it can feel uncomfortable to question them. Many people worry that asking too many questions might come across as distrust or hesitation. But in reality, the most responsible thing you can do for your health is to become an active participant in your care. Over the years, I've found that there are 4 simple but powerful questions that can completely change the direction of a medical conversation. These questions are not confrontational. They are not complicated, but they create clarity, and clarity is what allows you to make informed decisions instead of reactive ones. The first question is this: what happens if I do nothing right now? This question is incredibly important because it shifts the focus from action to understanding. In many cases, especially with slow-progressing conditions, the answer may be that nothing urgent will happen. And if that's the case, it opens the door to monitoring instead of immediate intervention. The second question is, how will this test change my treatment? This is where things often become very revealing. If a test is unlikely to change what your doctor would recommend anyway, then its value becomes questionable. A test should provide information that leads to a meaningful decision. If it doesn't, then it may not be necessary at that moment. The third question is, what are the specific risks for someone my age and health status? This is where personalization becomes critical. General statistics don't always apply to individuals, especially in older adults. Understanding how your body might respond to a procedure is just as important as understanding what the procedure might detect. And the fourth question is there a less invasive alternative? Medicine is constantly evolving, and in many cases, there are newer, safer ways to monitor health without immediately resorting to invasive procedures. Sometimes the best approach is not to do more, but to do less, strategically and thoughtfully. When patients begin asking these questions, something interesting happens. The conversation shifts. It becomes less about following a checklist and more about creating a plan that actually fits the person in front of the doctor. And that is where true patient-centered care begins. Now, let's take this a step further. Because avoiding unnecessary testing is only one part of the equation. The real opportunity lies in focusing on what actually supports long-term health and vitality. If you look at the research on longevity and healthy aging, a consistent pattern emerges. The people who maintain their independence, energy, and quality of life into their later years are not necessarily the ones who have had the most tests. They are the ones who have built strong daily habits. Movement is one of the most powerful tools available to you. It doesn't have to be intense or complicated. In fact, for many older adults, the most effective form of exercise is simply consistent, moderate activity. Walking, light resistance training, and maintaining mobility can have a profound impact on circulation, muscle strength, and overall function. Nutrition is another key pillar. As the body ages, its needs change. It becomes more important to focus on nutrient-dense foods that support muscle maintenance, cardiovascular health, and cognitive function. This doesn't require extreme diets or restrictions. It requires consistency, balance, and awareness. Sleep, often overlooked, plays a critical role in recovery and overall health. Poor sleep can affect everything from memory to immune function. Creating a simple, consistent sleep routine can make a noticeable difference in how the body feels and functions. And then there is something that is often underestimated but incredibly powerful: social connection. Humans are not designed to live in isolation. Strong relationships, regular interaction, and a sense of purpose have been shown to significantly impact both mental and physical health. In many cases, these factors are just as important as any medical intervention. In addition to these foundational elements, some individuals choose to incorporate natural support into their routine. For example, certain plant-based compounds have been studied for their potential to support circulation and cardiovascular health. Watermelon extract, which contains naturally occurring compounds that may support blood flow, is one such example. There are also formulations designed specifically for older adults that combine vitamins, minerals, and plant extracts to support overall vitality. Now, it's important to approach these options with the same mindset we've discussed throughout this video, thoughtfully and with awareness. No supplement is a replacement for healthy habits, but in some cases, they can serve as a supportive addition. As we begin to wrap up, I want to bring this conversation back to what matters most. Health is not just about avoiding disease. It's about maintaining the ability to live your life on your own terms. It's about having the energy to do the things you enjoy, the clarity to make your own decisions, and the independence to move through your day with confidence. The goal is not to do every possible test. The goal is to do what truly supports you. Because more is not always better. More testing does not always mean more safety. And more intervention does not always lead to better outcomes. What matters is understanding your options, asking the right questions, and making decisions that align with your values and your reality. If there's one thing I hope you take away from today, it's this. You have more control over your healthcare decisions than you might think. You are not just a passive recipient of recommendations. You are an active participant in shaping your own path. And sometimes, the most powerful decision you can make is to pause, ask questions, and choose a path that prioritizes your quality of life. Thank you for spending this time with me today. If you found this helpful, consider sharing it with someone who might benefit from hearing this perspective. And remember, your health is not defined by a checklist. It's defined by the choices you make every day.